Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with the May 13th, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. 32 new cases were added to Dubuque County's total today. As of May 13th, Dubuque County has 235 positive COVID-19 cases. That's a rate of 243 per 100,000 population. I want to express my sympathy to the families and friends of the 2 additional deaths that were reported today, which leaves a total of 9 deaths in Dubuque County. I'm very sorry for your loss, and please know that the public health team and many others are sensitive to these very untimely, unexpected, and difficult passings of your loved ones. And we are continuing to work on measures to protect our community's public health. 3,264 people have been tested in Dubuque County, about 7.2% of the cases tested have been positive. 16 individuals, or about 8% of COVID-19 cases, are currently hospitalized. And 75 people, or about 32% of Dubuque County positive cases, have recovered to date. The larger than normal cases reported today are a result of the targeted testing we completed last week. The testing of individuals with known exposures to COVID-19. All of those cases have been provided information on how to isolate, protect those around them, and most of all, how to take care of themselves. The state added 377 positive cases today for a total of 13,289. I'm sorry to report 17 additional deaths in Iowa for a total of 306 Iowans. In all, there have been 85,719 individuals tested. 1 in 236, or 15.5% of Iowans tested, have been positive. The 18 to 40 age group continues to be the highest number of positive cases category with 42%. Currently in Iowa, 388 cases are hospitalized, and 5,954, or 42% of Iowans, have recovered. Today, Governor Reynolds signed a new proclamation continuing the public health disaster emergency, but also the proclamation permits salons, barbershops, and massage and tattoo establishments to reopen throughout Iowa in a limited fashion with appropriate public health measures in place. It also permits restaurants, but not bars, fitness centers, libraries, and racetracks to open in the 22 counties where they have remained closed, including Dubuque County. All of these changes are effective at 5 a.m. on Friday, May 15th. These openings still require occupancy limitations, extra hygienic and sanitation requirements, and limits on the types of service. I'll provide more detail on these requirements once our public health team sorts through the details of the proclamation with our legal departments. In other words, it's somewhat complicated and full of special provisions, exclusions, and requirements. Now, the proclamation still continues the other ongoing closures and public health mitigation measures in place now, including the prohibition on social, community, recreational, leisure, and sporting gatherings and events of more than 10 people, along with bars, swimming pools, theaters, casinos, museums, playgrounds, and a few others. These continue to remain closed until 11:59 p.m. on May 27th, 2020. So, sporting leagues and other summer recreational activities like Little League camps and festivals and other mass gatherings will not be happening with more than 10 people until after May 27th, if things go as the governor is planning, that is. The Dubuque County Public Health Incident Management Team, along with the governor, want to continue to stress to all vulnerable Iowans, including those with pre-existing medical conditions and those older than 65, to continue to limit their activities outside of their home, including their visits to businesses and other establishments, and their participation in gatherings of any size and for any purpose. In addition to the governor's proclamations being modified, the Centers for Disease Control and Iowa Department of Public Health continue to update their guidance. For example, Iowans traveling outside Iowa but within the U.S. do not have to automatically isolate for 14 days upon their return, as they have in the past, as long as the traveler remains well and has not been identified as a close contact of an ill individual. Travelers should continue to practice social distancing and hygiene measures. This new guidance is for the general public. There may be some specific healthcare and other businesses that have different or additional requirements for travelers. The Iowa Department of Public Health has also provided additional information and changes for businesses and work sites, and I'll highlight these business reopening guidance features on a future Facebook update. So in closing, although many of the restrictions are being lifted and modified, we all have to evaluate ourselves, each individual person and their circumstances, to determine how much we do or return to normal, whatever that is. If you're older than 65, have underlying medical conditions including respiratory conditions, diabetes, obesity, are immune compromised, or have any conditions putting you at risk if you obtain COVID-19, please use extreme caution if or when you venture out into the community. We all have individual circumstances and cannot base our personal actions on the decisions or pressures of others. Thanks for tuning in today. Let's all continue to be safe, be smart. When in doubt, don't go out. And remember, we're all in this together.